Welcome to Save As Ability, a podcast to educate and inform you about disability employment issues. My name is David Darkangelo, and I'm your disability policy expert.
Hey everybody, welcome back for another episode of Save As Ability. We've been getting a great response. We appreciate you. We've had a great string of guests, and we have another great guest here today. Dahlia Shaewitz, thank you for joining us.
Hi, David. Good to see you.
And before we dive into disability and health, health equity, we're gonna talk about with Dahlia. If everybody could help us out by liking, subscribing, sharing, commenting, all of that really does help us keep great content flowing for you. And we want to build our channel, right, Dahlia? We want to make sure we're getting the message out about people with disabilities. And so it's great to have one of, really, I think you're one of America's experts on disability. You've done so many great papers, sometimes with a collaborator when you were at other organizations. I don't want to get into it too much. Dahlia, give our audience an overview of your expertise, and then we're going to dive right into this health equity topic that you've been working on lately with ThirdSight is the name of your organization, I think, right?
Yes, thanks, David. Dahlia Shaewitz. Again, I'm CEO and founder of ThirdSight. We are a Maryland-based company that focuses on disability inclusion. And I really mean all disability types. I spent a lot of years working in different wonderful firms where disability was part of the conversation, and I wanted to center it and make it the entire conversation.
That's how we originally met. I think you were at AIR.
Yeah.
And a mutual colleague, Michelle Yin, and you had produced really a tremendous paper on the economic impact of people with disabilities, among many that you both authored. But that's our original meeting point. And I think it's been, 10 years or something, Dahlia?
At least 10 years. Yeah, it's been great. Also collaborating with you on different projects. So, and nice to be on your podcast. So thank you for inviting me.
Well, it's great having you. And I know you're working on, through ThirdSight and with some clients right now, health equity and the intersection of where the disparities exist for people with disabilities. Why don't you tell us a little bit about what you're working on?
Sure. In this particular vein, because my passion is really employment outcomes for people with disabilities. But last fall, I applied and was accepted to be part of the World Health Organization's Disability Health Equity Network. And the work has just begun. It's a global group of organizations. I think there's over 150 organizations that are all working together to try to raise awareness and improve health outcomes and health equity outcomes for people with disabilities. So that's one of the things that we're working on at ThirdSight. I'm really pleased to be able to talk about it with you here today.
Well, that's great. So let's get right into it. Give us a little bit of an overview of how we're doing here in the USA and what does that compare to the rest of the world? Outline the parameters that we're talking about here.
Sure. So first, let me define what disability health equity is, because some people have heard of health equity, some people haven't. But disability health equity just means that people with disabilities have a fair opportunity to be as healthy as possible. It's not about giving special treatment. It's about removing barriers, because it's harder for people with disabilities to access healthcare. And then with healthcare also comes public services, information, housing, transportation, employment. So a lot of people think disability is about medical care, but health is shaped by our everyday systems, right? We're healthy if we can get out and walk, if we can get transportation to a doctor's appointment, if we can get to a job that provides us with healthcare that helps us achieve health outcomes. So globally, about 1.3 billion people have a significant disability. That's about 16% of the global population. Here in the U.S., the Centers for Disease Control and Prevention, or CDC, reports that more than 1 in 4 people have some sort of functional disability. So we're talking about a lot of people, a significant part of the U.S. population and the global population. The challenges, or the problem that we're trying to address, is that people with disabilities around the world and here in the U.S. tend to have poorer health conditions, and that means they're more likely to die earlier. They have a higher risk.
Some of that is intersected with their disability, and some of it is not, right?
It's a both and, correct? Because so just to put a fine point on it, people with disabilities are more likely to die younger, as much as 10 to 20 years younger than people without disabilities. They have a higher risk of chronic conditions like diabetes, depression, obesity, smoking, which is a habit, but also causes disease.
Sure.
And also they face a lot of environmental and social barriers. So it's a global health priority, right?
Right.
We need to be talking about it.
And we've talked about, one of the reasons why we emphasize employment here at Save Disability so much is because oftentimes with employment comes healthcare and things. Can you give us an idea of what we're talking about in terms of like people with disabilities and the percentage are using public healthcare versus employer healthcare versus their own payment healthcare?
That I don't have my fingers on that data, but I will say I am a proponent of universal healthcare. It would just make life so much easier. But it's not just about healthcare insurance, right? It's also about other kinds of barriers that people with disabilities face, structural barriers. For example, if you're in a wheelchair and you can't get into the building to see your doctor, that's an issue.
Right.
If you live in a rural area and it takes hours to drive to a doctor's appointment or some other healthcare facility and you don't have a car, how are you going to get there? Even in urban environments, it can be really expensive or inaccessible.
Right.
And then we know, you've talked about it on the podcast, people with disabilities are almost 3 times as likely to live in poverty. So poverty is a social determinant of health. And if you don't have access and you can't afford healthcare, even if you have insurance, you might have copays and you might have other kinds of costs, right? And then there are just health system gaps. So think about, has your doctor been trained on how to deal with people with disabilities? Are there inclusive data systems? We know we don't have enough data on people with disabilities. So even if I could tell you how many people have healthcare coverage, I can't tell you how many people with disabilities.
And the
have
differing definitions, the CDC and the BRFIS and the STIP have different definitions. And is it, to the ADA definition and the Census Bureau? I know it's challenging.
Yeah. And there are people who need routine healthcare. So if they don't have access to transportation, if they don't have access to systems, because those systems are not accessible, like data systems going online, everyone has to do everything online, right? So if you can't get online because you don't have access to the internet or a computer, how are you going to make the appointment with the doctor? And so it leads to delayed care, preventable health issues,
When I was
worsening health
at
outcomes.
NCD, we did a big report on dental care and how key dental care is part
Yes.
of the person's overall health care.
Yes.
The more healthy your dentistry is, your dental output here, oftentimes you have a better health outcome.
Well, that's so interesting because I worked years ago on a health Head Start study, and one of the findings they had was that children who get dental care early by age 3 or 4 tend to have better education outcomes as well. So that really shows the connection: healthcare, education, employment, just community engagement. Everything's connected.
It
So if we're
really
talking
is.
about disability health equity, we're also talking about kind of equity writ large, right, for people with
Yes.
disabilities.
All right, as we begin to conclude here, let's talk about
Yeah.
some outcomes. Let's talk about some action points that people can do to, I don't know, to get involved with your initiative or to learn more.
Yeah. Well, so I'm a big believer that all means all, right? So if you're thinking about a policy, for example, here in my county, I meet with a lot of legislators and they'll say, oh, well, this is the policy related to people with disabilities. And I say, every policy you're talking about impacts people with disabilities because it impacts people. And a quarter of the people in your community have a disability. So you have to look at every policy through a disability lens. And then another really easy thing to do now with AI, make everything at an 8th grade reading level. Just whatever information you want to share, run it through AI and say,
Right.
make this an 8th grade reading level, make it simple. It doesn't just benefit people with disabilities, it benefits everyone. I would like to understand the medical advice I'm getting, and making it simple and plain language can really help.
Well, really
So
what you're advocating for, great minds think alike. Our past 2 guests have been, beating the same drum of universal design in these programs. And if you can build it for use case scenarios that start at a little bit more challenging, start at providing the accommodations, well, then you're going to make it more accessible for everybody and available for everybody.
I think that's right. So I really want to hone in on the idea of intentionality. Be intentional in thinking about how you're including everyone, ask who's missing from the table. Who am I not thinking about? Who do I need to be including? And also think about the outcomes, the benefits, right? Because if you're making things accessible for people with disabilities, you're actually going to end up making it accessible for everyone. I mean, curb cuts is the most common example that everyone uses.
But if you can't get into your doctor's office, you can't get health care. So, I mean, yeah, all of it is, related, and it all matters.
Yeah. And so the reason everyone kind of should care about the issue is because if you make the system better for people with disabilities, you are making it better for everyone, and that benefits all of us. So everyone can take some action.
Yeah. And as we age, we tend to, the health situation tends to get a little bit more intense for individuals. They tend to enter disability more. I know.
Yes.
All right. As we conclude here, then, why don't you give everybody out there an opportunity to get in touch with ThirdSight and you to find out more and learn more?
Oh, sure. Yeah. Happy to talk with anyone about the topic and think about ways to raise more awareness about the issue. Our website is www.ThirdSight.com. And you can reach me at info@thirdsightllc.com. Happy to talk to anyone about the topic. And again, this is a global movement. So the more people who join, the better.
All right, terrific. Well, we'll be sure to put those links in the description.
Great.
And Dahlia Shaewitz, thank you. We appreciate you for coming on Save Visibility today.
Thank you. Thanks for having me, David. I appreciate it.
Well, it was great to have you. And everybody out there listening and watching, we appreciate you. It's David D'Arcangelo, another episode of Save Visibility. I hope you have a great day.
For more information about disability employment issues, please visit our website, disabilityemploymentsolutions.com. The Save As Ability podcast is available on Apple Podcasts, Spotify, our YouTube channel at Disability Policy Expert, or wherever you stream your podcasts. Subscribe, stream, rate, and review our shows. Your ratings and reviews help our show reach new audiences. Produced by Pod Pro Entertainment. Save As Ability lives within a network of podcasts located at podproentertainment.com. #TheNewRadio. Again, my name is David D'Arcangelo, and I'm your disability policy expert. Until next time, thank you. I hope you have a great day.